Hi everyone, I'm going to tell a little story before we begin our discussion. A rich man married two ladies on the same day. He housed both of them differently. As the marriage went on, he realized that one of the wives cooked better than the other. So he started moving every day to go and eat with the one that cooks well all the time, and lessly frequented the one who wasn't a good cook. As time went on, he totally stopped going to the wife that was not a good cook and only concentrated on the wife who was a good cook. Eventually, they got divorced. Then he stuck to the wife who was a good cook. This is the story of LazyEye, the love life between the brain and the two eyes that we have. Now, LazyEye, as most of you know, is what you would see as somebody without one of the eyes moving out or in. But that is one of the causes of lazy eyes, or the signs of somebody with lazy eye. But lazy eye simply means when the brain favors one eye rather than the other due to poor vision, that the bad eye that is less favored is supplying to the brain. Eventually it leads to visual impairment and total blindness sometimes, or total vision loss sometimes. When a child is born, the brain and the eye work together so as to develop the part of the brain responsible for seeing. So each of the eyes supply images separately to the brain. And as that goes on, the brain tends to develop the parts that is responsible for sight in the brain. And as that development goes on, there's a great match between the part of the eye and that specific part of the brain. So each eye releases impulses to one part of the brain, and the other eye releases impulses to another part of the brain. Now both parts of the brain then develops independently and helps us to see. So this developmental process of the brain and the eye coordinating and mapping to help us see is the process we call a metropization, which means the eye and the brain working together. Now during that process, there can be hindrances, and when those hindrances occur, it then makes that eye that has the hindrances the wife that is a bad cook. So eventually the brain will then neglect that bad eye and only favor the good eye that is supplying the good images to the brain. So that part of the brain for that eye becomes well developed, and the other eye that is not supplying good images will have that part of the brain underdeveloped. As of now, we've gotten to know the basis of what lazy eye is. So what are the signs that will help you know somebody has lazy eye? The first sign you might see in most people is wandering eyes. In certain individuals, you see their eyes as they're looking at you. Another one might be looking elsewhere, which we call alogamy, or squint, or strabismus. It tends to look away. And when you realize that that's the first sign of somebody who might have lazy eye. The second one is somebody would also complain of double vision. So if, let's say, you are presenting something to someone and it's just a pen, the person might ask you, which of the pens do you want to give me? Because they are going to see in double vision. The second one is there's poor coordination between the eyes. See, the person is trying to look at something. You realize that somebody might be staring at you, but one eye will be focused towards you and another eye will not be able to catch up properly. And that will be another sign of lazy eye. Also, you can have individuals who might be missing things. Normally, when you have a problem in lazy eye, the two eyes can't function properly. So you have the difficulty of seeing things in three dimensions. When that happens, certain individuals cannot really judge depth perception. They won't really judge distances. So you end up missing steps. Let's say if there is a a gutter, they might miss it and step into the gutter thinking they've already overstepped it. Or if they are going to dodge a wall, they might hit their shoulders to the wall. This is some of the signs that you might see in somebody who might be developed lazy eye. Now, in other individuals, because they have some of these signs, they might end to squint a little to reduce the effect of the lazy eye. So you can see them squinting most of the time. And when that happens, it shows that that person might be suffering from lazy eye. Now, what might cause all this problem? As I told you, the rich man stopped going to visit the other wife because she was a bad cook. In the same way, your eye will only reject, your brain will only reject your eye if it's not supplying it with good images. So what will cause your eye not to supply good images to your brain? Those are the causes of lazy eye. And the first one will be difference in vision between the two eyes. There are certain individuals, there's a total difference in vision in the two eyes. Therefore, the brain can't use the two images since they are totally different. And that might cause lazy eye. The second one will be uncorrected refractive error. Let's say this individual is supposed to wear glasses to treat his seeing problem, whether it's a long-sighted person or a short-sighted person or an astigmatic patient. If the person doesn't treat that problem, it will also cause lazy eye. Another reason why somebody might develop lazy eye is also from trauma. Example, if somebody hits your eye and your eye becomes it's hurt so bad, the lens in the eye that helps you to see is broken, it will also lead to a lazy eye. It can also even be from your retina, that's the back of the eye that has a film there, also be detached. That can also cause the lazy eye, because when that happens, no images will move from your eye to the brain, and the brain end up rejecting it. And that problem that might happen is we are supposed to have images move into our eye to our brain. So when you have one eye drooping, going down, covering one of the eyelids, going down, that's drooping and blocking the vision. There are certain individuals, when you look at them or they look at you, one eye will be down this way and the other one will up. So which means that this eye will be seeing properly and this eye will be seeing and not so well. So that drooping eye will cause the brain to neglect the eye with the drooping eyelid, and that will also cause lazy eye. Another reason that can lead to lazy eye is surgery. Let's say somebody is born with a cataract and the person undergoes surgery, and the lens that they put in the eye, that's the intraocular lens, is not well placed. It means the person will have a bad vision, and that can also lead to a lazy eye. You also have glaucoma, which is the sanity of sight, which will eventually cause reduction in vision. The peripheral vision will be lost, and the central vision will be lost, and that gradual losses might cause the brain to avoid using that eye, leading to a lazy eye. Also, the vitamin A deficiency, because the retina of the brain, the retina of the eye needs vitamin A. Lack of vitamin A will cause the inefficiency of the retina. That can also lead to lazy eye. And finally, some people have a genetic disposition of developing lazy eye. So your genetics, how God created you, can also lead to you developing lazy eye. Now, after you said all those things, how would one treat somebody with lazy eye? As I said, the time the brain and the eye coordinate is between around birth, towards 6 months old, towards 12 years old. That's when the eye and the brain do coordinate. So how would such an individual be treated if you see that there are these signs, or these signs might lead to lazy eye? Now, in treating lazy eye, we only treat the cause of the lazy eye. As I said, if the vision is restored or the brain is allowed to get clear vision from the eye, then we treat lazy eye. So let's say if the cause is the refractive error, by seeing your optometrist or your eye doctor, lenses will be produced, that's spectacles or contact lenses, to be produced or given to the individual, thereby treating the cause and therefore treating lazy eye. If it's a drooping eyelid that is obstructing the vision, surgeries can be done to retract the eyelid, and then the individual can see. If it's an eye wandering in and out, aka alugmi, That is, in most people, by doing surgery, the eyes can be realigned so that the eye doesn't see double, and then the brain can use the images from the LazyEye eye. Furthermore, if there's anything that is obstructing the eye, let's say a bad surgery where an IOL wasn't well placed, another surgery can be done to realign the intraocular lens in such a patient so the individual can see. Once the patient is able to see, we've treated LazyEye. Now, in most cases, the only option is to punish the brain. Remember the story I told you at the beginning? If the husband is forced to stop eating from the good wife and starts feeding from the bad wife, he might find taste in the bad food that the wife cooks, because they say that in the absence of nothing, bad is good. So we can only do that to the eye by penalizing the eye. Now, in these cases, eye drops or parchment can be placed on the eye. We call an eye patch. It's placed on the good eye, thereby restricting vision only from the bad eye. In this case, the brain has no option than to use the images from the bad eye. Places in the brain responsible for that vision will be stimulated, then the vision will be restored. It's either by drugs or by parchment, and once the eye is patched, the brain will be forced to use the eye, thereby treating the LazyEye. Now, at the end of all this treatment, what does your doctor do to help an individual who has LazyEye? The first eye examination to be done by every individual is at 6 months. At that point, most of the sensory parts of the human eye is developed, and your optometrist or your eye doctor can find the possible causes of the LazyEye. If it's a refractive error, you can see children may give it glasses. If it's in misalignment, the doctor can refer the patient to surgeons for them to do the alignment. So you have to visit your doctor and let your children have their first eye examination at 6 months. So when the first eye examination is done at 6 months, whatever be the possible cause of any LazyEye will be found and will be treated. Now, from that 6 months onwards, an individual is required to do a yearly eye examination. So if you want to protect you and your family from LazyEye, first eye examination for your ward is supposed to be 6 months, then after that yearly, so that every possible cause of LazyEye will be detected by a doctor and it will be found. So someone will ask, what will my doctor do when I go to visit them? He might check for clarity of your vision. You might check for how your eye muscles are working together. You might check for how your eye muscles are focusing. You might check for coordination between the eyes. These are all things that your doctor will do at his or a clinic to find out if there's any possible cause. This has been Dr. Roxon from Fresh Eye Center. And if you have any other questions, you can post them for answering. Thank you, and hope we meet you next week. Bye.